this lecture presentation, we'll review coping responses to stress, including factors that influence stress and coping, various coping styles and strategies, and changes we can make in our lives to facilitate well-being, resiliency, and potentially post-traumatic growth. This material is aligned with Robert Sapolsky's Why Zebras Don't Get Ulcers, chapters 13, 17, and 18. Before we get started, I recommend having your slides available so you can take notes throughout the lecture presentation, and the interactive study guide nearby so you can complete it as we move through the material. Let's start by looking at the steps an individual takes when coping with stress. Step 1 is assessment. This is the step in which the individual wants to identify the sources and the effects of the stress to better understand the situation. Next, the individual would engage in goal setting. Here, the individual will further consider what the stresses are and how the person might respond to those stressors. Part of step 2 is determining which stressors are within the individual's control and which are not. Next is the planning stage. Planning involves listing out some specific steps that could be taken to more actively cope with stress. In the action stage, the person actually starts implementing the coping plan that was created in step 3. This involves cognitive, emotional, behavioral, and/or physical approaches. In essence, the action stage involves actively implementing the coping plan. The types of coping methods vary depending on the individual and the type and intensity and duration of the stressor. In general, those who are flexible and can adjust tend to fare best. There are generally helpful coping responses, such as trying to solve the problem, sit with one's emotions, express themselves constructively, or engage in relaxation exercises. There are also generally harmful approaches to coping, such as catastrophizing and ruminating. Catastrophizing involves kind of a tendency to exaggerate a stressor to the worst-case scenario, whereas ruminating is focusing one's attention on the causes and consequences of stress. Step 5 is the evaluation stage. It is in this stage that the individual evaluates how effective their coping methods were in terms of the stressor and the stress response. This leads to the adjustment stage. It is at this point that the individual may need to alter their coping methods, if it is the case that in the evaluation stage it was determined that the coping responses were insufficient or problematic in some way. All 6 of these steps are affected by various individual and sociocultural factors, including the individual's personality, the type and intensity and duration of the stressor, the degree of perceived control, predictability, and self-efficacy, lifestyle factors like exercise and mindfulness or meditation practices, the individual's socioeconomic status, social support, and social capital, the individual's overall psychological flexibility, self-insight, and adaptability, their readiness for change, and the coping styles or strategies that characterize that person's response to stressors. Some work better in some situations. In this lecture presentation, we'll start by exploring factors that affect the stress-coping relationship. Then we'll learn a framework for evaluating an individual's readiness to change. From there, we'll discuss coping styles and specific coping strategies. And then we'll end the lecture looking at factors associated with resilience and post-traumatic growth. Psychological variables are known to modulate the stress response, and they can even trigger the stress response. 2 factors that have been shown in the research to significantly influence the stress coping response is the degree of predictability and control that an individual feels in a given situation. It's important to point out that this is about the perception of predictability and control, not the actual degree of predictability and control that the person might actually have. In terms of perception of predictability in general as human beings helps us feel more in control, which is part of the relationship here. Predictability helps make stressors seem less stressful. We like to think we know what's coming. Predictability is also helpful in that it gives us some clues about what our best coping strategy might be and the timing of that strategy, that is, when we need to implement it and how long we might expect to implement it for. Predictability is helpful in certain cases, but not in all. The most important variable when it comes to the perception of predictability is whether that predictability is accurate and whether it's manageable information. For example, predictability is not helpful if the stressor's coming in a second from now. You don't have time to prepare. It's also not helpful if it's coming decades from now. It's too far away to actively prepare for it now. Predictability is also not very useful if the stressor seems too much to handle, is too vague to really understand what it means, or if it's just too bad that we can't prepare ourselves for something that awful. Essentially, predictability is not helpful if the stressor is terrible, rare, extremely frequent, or too close or too far away in time. When it comes to the perception of control, this too can be problematic in certain situations and potentially helpful in others. It's problematic if it leads to blaming oneself for a poor outcome, but it can be helpful if it clearly could have been worse, if perhaps something we did made it better, even in some small way. When it comes to control, finding meaning can be really helpful for increasing one's sense of control. For example, pain is oftentimes perceived to be more manageable if the person has access to a painkiller. Of course, that approach, while it is helpful in terms of the perception of control, actually leads to increased propensity towards habit formation because the person is more likely to be paying attention to their pain so that they can determine when they should intervene by taking painkiller medication. The research suggests that high control appears to be most useful when there's also high predictability. And again, this doesn't have to be real. It's about the belief that something is controllable or manageable and predictable in some way. Individual self-efficacy refers to one's belief in their capacity to deal with a given situation. Perceived predictability and perceived control generally increase an individual's sense of self-efficacy. Self-efficacy also relates to the individual's belief that their coping responses will be viable and/or doable. The opposite of psychological control and psychological self-efficacy is learned helplessness, which is highly associated with depression. The more self-efficacy an individual experiences, the more likely they are to be able to face their stressors with confidence and with effective coping skills. One aspect of coping in terms of the stress response has been the question of what role religion and spirituality play in potentially moderating this relationship. It appears that religion and spirituality are good examples of the chicken and egg phenomenon. It's unclear if healthier people are drawn to religion, or if religion actually makes someone healthier, or both. Religion and spirituality appear most helpful for reducing risk of illness rather than treating it. One of the major interpretations as to how religion and spirituality can be helpful in terms of health is that both are associated with increased social support and decreased engagement in risky and unhealthy activities. Most organized religions, as well as people who are considered spiritual, tend to spend a lot of time with other people who share that perception of the world, and they also tend to engage less in substance abuse and in other problematic activities that increase the risk for poor health outcomes. In particular, religion and spirituality appeared to help protect against cardiovascular diseases and depression. Interestingly, the deeply religious do not fare any better than the less deeply religious, so it doesn't seem to be that there is a relationship in terms of the intensity of religion, so much as having a belief system where there is some higher power that the person believes in and derives potentially some sense of predictability and control from. As I stated earlier, it appears that it's more about healthy people staying healthy rather than making sick people healthier. Exercise and meditation are intimately intertwined in the discussion of coping. First off, exercise and meditation are excellent daily lifestyle activities that can help buffer against stressors and promote contentment and well-being in the individuals who practice them. Exercise and meditation can also be explicit coping strategies that an individual might engage in more because they are experiencing stressors. Exercise blunts the stress response for hours after each session, and perhaps up to an entire day afterwards. The person typically will experience enhanced mood. It's important to note, however, that all exercise is not created equal, nor is the amount of exercise necessarily equally healthy across the board. Exercise seems to be most helpful if the person wants to do it, which is why it's so important for somebody to find a form of exercise that they enjoy. Forcing yourself to exercise is as stressful as forcing yourself to do anything else that you detest. It's also important that exercise occur in moderation. Too much exercise can be just as bad as too little, and over-exercising is certainly a stressor to the body. The research suggests that in terms of coping and its impact on the stress response, aerobic exercise is actually better than anaerobic exercise. That's not to say that both don't have their benefits, but if engaging in a behavior specifically for its stress-relieving results, it's important to at least be engaging in aerobic activities and not solely anaerobic ones. Aerobic means with oxygen, and it refers to activities that we traditionally refer to as cardio, ones in which we have increased breathing and heart rate for a sustained period of time, like going for a jog, or a bike ride, or swimming. Anaerobic means without oxygen. These are the types of activities where the person cannot sustain the activity for very long, things like sprints, high-intensity interval training, and intense weightlifting. I also want to point out something we've talked about previously, but one effective consequence of exercise in terms of stress management is increased BDNF activity, which facilitates synaptogenesis and potentially neurogenesis as well. In order to derive maximal benefits, exercise needs to be regular, that is consistent, and sustained. A good goal is 20 to 30 minutes at least 3 times a week. Meditation refers to altered states of consciousness that's characterized by inner peace and tranquility. It is essentially intense focus on a present experience, such as a mantra, until sensation occurs that is aligned with the concept of pure awareness. When it comes to meditation, the research is very compelling in terms of the very many benefits that it bestows upon the individual who practices it. Meditation's associated with enhanced stress reactivity, immune functioning, and overall physical and mental health. People who meditate tend to be able to recover from stress better. They are healthier, and not only in terms of their physical functioning, but in their mental health as well. When it comes to meditation, 15 to 30 minutes daily appears to be a good goalpost. With that said, I don't want to scare anyone away from meditation, as 15 to 30 minutes every day might seem like a lot. It is absolutely the case that any amount is better than none. So if you can get in 3 minutes a day, wonderful, go for that. Meditation is associated with increased dopamine activity that provides that sense of pleasure and reward, increased activity in brain regions linked to attention, so it enhances executive functioning and can be a very effective strategy for ADHD in addition to other approaches as well. Also, increased connectivity among brain cells, otherwise known as integration, neural integration, is very powerful. This can also be helpful for individuals with ADHD, along with many other conditions and people who don't meet diagnostic criteria for anything, because an integrated brain is a better functioning brain, particularly integration of the prefrontal cortex and the limbic areas, so the individual has more control over their emotional responsiveness and are generally less labile. Lastly, individuals who meditate appear to have higher pain and distress tolerances. Pain generally refers to physical pain, whereas distress oftentimes more so refers to psychological pain. It's unclear how long the benefits last, but meditative states, by increasing dopamine, executive functioning, integration, and distress tolerance, likely underlie why it's a big part of many approaches to therapy, including cognitive behavioral therapy, acceptance and commitment therapy, as well as dialectical behavior therapy. You might consider pausing the recording here to watch the video, Hack Your Brain's Default Mode with Meditation. Socioeconomic status directly and indirectly affects the stress-coping relationship. Low SES is linked to increased stress across a variety of variables. Interestingly, while low SES is theoretically objective, subjective SES appears to play a role as well. That is, what an individual thinks or feels about their socioeconomic status in comparison to others. Therefore, someone who is objectively middle or upper SES may experience stressors that are more associated with low SES. This includes psychological variables like satisfaction with one's lifestyle, and again, the ever-important degree of perceived predictability and control. Low SES is linked to increased physical and psychological stress. This is due to limited coping responses that occur as a lack of reserves and limited outlets, including social support. In low SES areas, individuals are oftentimes preoccupied trying to address their basic needs and do not have the luxury of engaging in the coping responses that individuals of higher SES oftentimes do, like yoga, meditation, and massage. SES is also linked to risk factors and protective factors. Individuals with low SES oftentimes have less access to a healthier diet. They oftentimes cannot afford organic food and a lot of produce. They tend to have fewer opportunities for exercise, both in terms of time as well as safety. Exercising outside of the home is a luxury we have in environments that are safe. There's also increase in unhealthy coping strategies like smoking and alcohol use. Decreased education is associated with ignorance regarding healthcare, and that can have effects both in terms of not engaging in proactive strategies to keep oneself healthy, but also not knowing when to react to signs and symptoms that more educated people would be aware of. And again, even if you've learned the strategies that might be helpful, you might not have the time or resources to fully engage in them to the same extent. Low SES is correlated with poor health and earlier mortality. This is directly associated with accessibility and quality of healthcare, but this only accounts for a small part of the variance. Again, factors like diet, exercise, coping strategies, education, and environmental challenges, such as high toxicity, high crime rates, a lot of crowding and poverty, even pollution from noise, all decrease opportunities for effective coping and add to the overall sense of stress that an individual is going to experience. When you combine low socioeconomic status with low educational outcomes and high levels of distress, you can see where maladaptive coping styles would come into play. It's related to things like limited insight, low self-efficacy, low perceived control and predictability, potentially issues with communication and problem-solving skills, lack of social support, and lack of resources. And again, these individuals are also exposed to more violence, more crime, more parental stress, more toxins, more unhealthy dietary choices, less access to healthcare, and a variety of other contributing factors as well. Perceived social support is linked to better adjustment to and faster recovery from medical issues. But social support is really only helpful if it's a good quality relationship. When it is, it's linked to lower mortality rates overall and less distress when faced with terminal illness. When it comes to social support buffering stress by aiding coping, there are two important hypotheses. These are the buffering hypothesis and the direct effect hypothesis. The buffering hypothesis states that social support mitigates stress indirectly by aiding our ability to cope effectively. Conversely, the direct effect hypothesis suggests that social support enhances the body's physical resources for coping with stress. It's likely that both of these underlie the importance of social support in terms of effective stress management. Another hypothesis that's important to this discussion is the matching hypothesis, which states that social support must be desired, must match the individual's needs, and most importantly, must be noticed in order to have a positive effect. Interestingly, the research suggests that instrumental support, which involves helping other people, can actually be more helpful than receiving emotional support. This suggests that giving might be better than receiving. The opposite of social support is a sense of isolation, which in and of itself is a stressor that activates the sympathetic nervous system. This then leads to higher blood pressure, which is a risk factor, as we've discussed previously, for atherosclerosis and other cardiovascular conditions, as well as poor lifestyle choices. If you don't have people to spend time with, you're more likely to stay home, make unhealthy dietary choices, watch TV, play video games, and otherwise not move around as much or gain as much social connection. Isolation is associated with a 2 to 5 times higher risk of heart disease and 3 times faster rate of dying from heart disease compared to individuals who perceive themselves as having sufficient social support. Social capital is based on trust, reciprocity, lack of hostility, and participation for the common good. Essentially, social capital refers to people who work together effectively and share a sense of identity, norms, and values. High social capital is associated with less social isolation, less stress, and better public services, including better education. Low social capital, however, is associated with increased crime, which has been interpreted as displaced aggression. The more income inequality in a given area, the worse the health and mortality rates in that area. This is particularly true when it's compared to the immediate community. But interestingly, the research suggests that with widespread media, the sense of an immediate community has been widened considerably. Social capital affects everyone. It is not only the individuals who are in the lower SES population in a given group who experience the negative outcome of low social capital. Instead, areas with high income inequality have low social capital, and that is associated with poorer health for everyone in that community. I also want to remind everyone that good quality coping repertoires and social connections are privileges. It takes time and resources to engage in these behaviors, and it is something that not everyone has the luxury of doing. One aspect of coping and resilience is how willing someone is to change their behavior. For example, if someone recognizes that exercise might be helpful for coping, but are not willing to do it, they are not going to benefit from their knowledge of the effectiveness of that coping response. One major way that individuals can assess readiness for change is through Prochaska's model. Prochaska's model is sometimes referred to as the readiness to change model. It's also referred to as the stages of change model. I'll talk about Prochaska's model in just a bit, but first I want to discuss the idea that health-related beliefs directly and indirectly affect coping behaviors. That includes how our perceived degree of risk affects our choice in coping, the perceived seriousness of the consequence of the stressor in terms of how willing we are to engage in a coping response or in some kind of change, the belief that changing the behavior will actually reduce the threat. If we don't believe it's going to matter, we're unlikely to do it. The balance of perceived costs and benefits of change. Perhaps change would be beneficial in certain ways, but if the cost is perceived as greater, that individual is unlikely to want to make that change. Self-efficacy that change is possible is also very important. If an individual doesn't believe they're capable of change, they might not be willing to try. And then psychosocial factors are also very important. Things like what's happening in the community, how much stress there is overall, what your peers or your family might think. As I mentioned earlier, Prochaska's model is oftentimes used as a strategy for evaluating where somebody is on the spectrum from completely unwilling or not even recognizing the need for change to already have made the change and are in that maintenance stage. Let's go through each of these stages. First, pre-contemplation. The pre-contemplation stage is the no stage. This is when the person is not even thinking about changing their behavior. They do not admit that there's a problem, and they don't think anything needs to be changed. That is why they are pre-contemplation. They haven't even reached the stage of thinking about it yet. The next is contemplation. In this stage, the individual acknowledges the existence of a problem and is considering change. This is the maybe stage. They haven't committed to change, but they also acknowledge that maybe there's a reason where change would be warranted. Next, the preparation stage. Just like it sounds, the individual in this stage is preparing to take some kind of action towards changing their behavior. This might involve researching what their options are, or making preliminary calls to therapists or to rehabilitation facilities. The action stage is when the person actually starts making a change in the behavior with the goal of sustaining that behavior. The action stage is the first 6 months after the person begins to change. Lastly, the maintenance stage is continued success in that behavioral change. The demarcation point of action to maintenance is at that 6-month mark. I want to note that people pass through these stages in a non-linear fashion. It is not necessarily sequential, and these steps can overlap with each other. One day an individual might say, yes, change is needed, and the next day might say, actually no, on second thought, no change is needed. So it's not necessarily the case that an individual will linearly proceed from pre-contemplation to maintenance. They might also get stuck in a stage along the way. Effective coping relies on making changes that are in the individual's control that facilitate their well-being. As therapists, one thing that we offer our clients is the ability to self-reflect on where they are in terms of these stages and to better evaluate, even through listing and looking at pros and cons, why an individual might consider progressing along that spectrum towards action if, again, a change is actually warranted. As I mentioned earlier, the types of coping methods that an individual might engage in depend on a lot of individual and sociocultural factors, as well as the type, intensity, and duration of the stressor. Again, those who are flexible and can adjust tend to fare best, because accepting the moment as it is, while doing what is within our control to make things better, is often an appropriate and effective response to stress. Different approaches work better in different circumstances, which speaks to the importance of flexibility. When an individual rigidly adheres to a certain approach to coping, they oftentimes will just keep trying harder and harder with the same approach, which is not only frustrating, but often incredibly ineffective. The research suggests that it's best to balance hopefulness with the possibility of a poor outcome. We want to believe it can get better without denying the possibility that it might not. Hopefulness involves hoping for the best, but also having some preparation in case the worst may come. Approaches to coping are affected by an individual's dispositional affect. Individuals who have more positive affectivity, who are characterized as happy, calm, and optimistic, tend to fare better than those with more stereotypical negative affectivity, those who are more neurotic, hostile, or pessimistic. In general, those with higher positive affectivity, particularly optimism, will fare better in regard to effective coping. Coping can be subdivided into approach coping and avoidance coping. Approach coping, just like it sounds, is when we engage with the stressor and with our coping responses. Avoidance coping is generally more disengagement. It's moving away from or avoiding that stressor. oftentimes through substances, or video games, or a Netflix binge. The next way we can subdivide approaches to coping is in cognitive, emotional, behavioral, and physical coping. Cognitive coping refers to coping with thoughts. That is, changing how we think about the stressor. Helpful cognitive coping strategies involve staying calm and constructively figuring out the problem in one's mind. It might also include cognitive restructuring, such as changing a harmful thought into a more helpful one, also known as reframing. Harmful approaches in terms of the cognitive coping styles are catastrophizing, ruminating, and again, avoidance and distraction, which has its place and can occasionally be effective, but oftentimes creates more problems than it solves. Emotional approaches to coping involve feelings, so seeking social support, providing social support, and getting advice. Perhaps it's crying into a pillow or getting a hug from a friend. Behavioral strategies refer to actions, which again might involve creating a time management plan, using external aids like calendars, to-do lists, alarm clocks, and then making life changes. For example, not watching television or being on your iPad in the 2 hours before you try to go to sleep. Physical coping refers to the physical body, and it includes things like muscle relaxation, and we'll try a couple of those exercises later in this lecture presentation. It also includes things we've talked about previously, like exercise and meditation, as well as yoga, biofeedback, and even medication. When it comes to problem-focused versus emotion-focused coping, problem-focused are those coping strategies that address the source of the stress or the problem itself. It's attempts at directly dealing with the stressful situation. While it tends to be more common in males, anyone can engage in problem-focused strategies. Examples would include confronting the problem, seeking social support, planful problem solving. It could also include therapy, such as developing coping skills, talking to a boss, parent, or supportive other, particularly in terms of actively solving the problem, creating smaller steps so the goal feels less overwhelming, or prioritizing based on how important something is or by deadline. Emotion-focused coping responses address an individual's own emotional reactions to a stressor. This is attempts at regulating the emotional reaction. While this is more common in females, it can also apply to individuals across the board. Some examples of emotion-focused coping would be self-controlling, that is, not allowing the self to feel it or to emote about it, distancing, to keep it out of the person's mind, or positive reappraisal, changing your mind about the situation or finding some positive aspect or silver lining. Which coping strategy we use in any given situation also depends on how we appraise the stressor and how much control and predictability we think we have. These are not mutually exclusive. One individual might engage in all of these approaches depending on the given situation and the stressor involved. Let's look at some individual approaches to coping that are aligned with the cognitive and behavioral model. Starting with cognitive restructuring that I mentioned previously. Cognitive restructuring is actively replacing maladaptive and self-defeating thoughts. It begins with recognizing these thoughts and then engaging in active replacement, really asking the person to identify another way of thinking about that thought. Stress inoculation training is a 3-step model. The first is reconceptualization, which is akin to reappraisal and can involve cognitive restructuring. Next, skills acquisition. Here the individual learns coping skills like relaxation, breathing, imagery, and humor. Next, once the individual has acquired effective skills, they practice follow-through, which is practicing the utilization of reconceptualization and in the explicit coping skills that were developed in the previous stage. Psychological diffusion is a personal favorite of mine. Psychological diffusion is essentially approaches that help to disempower or defuse an individual from their own thoughts through distancing and also acceptance. Psychological diffusion is not a distraction technique, and it's not an avoidance technique either. It involves actively noticing the thought, but then choosing to engage in a behavior that reminds us that our mind provides a lot of mental chatter, and thoughts are not necessarily facts. There are many approaches to psychological diffusion. One of them is to repeat your thought back to yourself, starting with, I am having the thought that. So if I am really stressed out because I'm worried I'm going to fail an exam, and I'm saying, I'm going to fail, I'm not going to make it through this semester, that I would notice it then, and then say, I'm having the thought that I'm going to fail. I'm having the thought that I can't make it through this semester. Another approach is to use a different voice or a different character. I have a lot of clients who love this approach. They give them interesting names, interesting voices, and whenever that kind of part of their mind comes up and it's telling them all of the things that they need to worry about or all of the ways in which they're going to fail, that they hear that voice as something that makes them laugh or helps them recognize that this is just an aspect of their mind. This is not a statement of reality of who they are or what they're capable of. The next is called the naming the story technique. This involves identifying what that mental chatter is thematically. So for example, here's the failure story again, or here's the I'm not going to be able to make it through the story again, or here's the nobody likes me story again. Next, to describe the thought or feeling. The person might say, my sadness feels like a heavy bowl of water and it's overflowing and it has hard edges. Just doing that, really coming into touch with how the person feels and conceptualizing a thought or a feeling as some kind of conceptual, more tangible thing can also be really helpful for distancing the person. Lastly, another diffusion technique, and there are many more than this, is just to keep repeating the same word or phrase over and over again until it loses some of its intensity. I am terrible and no one likes me. I am terrible and no one likes me. I am terrible and no one likes me. Eventually, the words start to feel funny and they lose their impact. Next, emotional disclosure and expressive writing. These can be really helpful for reducing avoidance tendencies. They help to externalize our feelings. They also help to elicit support and self-insight. One really important aspect of successful expressive writing in particular is that the individual needs to be free to express themselves in whatever way comes up. People who sit down to journal with an identified topic and who proofread as they go oftentimes lose the full experience of completely expressing what is going on in their thoughts and feelings. Gratitude journaling can also be really effective. I love gratitude journaling because it really helps facilitate a shift from a deficiency orientation where the individual is constantly focusing on what they don't have, what they haven't achieved, where their life is worse than someone else's, to a gratefulness orientation, where despite the fact that those things still exist, there are many things to be grateful for, even if those things feel relatively small in the moment. Self-compassion also helps to aid resilience and promote contentment, similarly to gratitude journaling. Self-compassion refers to giving ourselves kindness, care, understanding, a sense of connection and awareness. Now, of course, it's exceptionally important that we engender compassion not only towards ourselves, but to others as well. But I have found in my clinical work that the vast majority of individuals that I interact with struggle much more intensely with self-compassion than with compassion towards others. Another really important approach that I find very valuable in my work with clients is discovering and connecting to an individual's sense of meaning, purpose, and values. Really choosing to engage in behaviors that are aligned with what we see as our purpose in this world, with things that feel meaningful and fulfilling, and that align with our goals and our values. The more choices are intentionally aligned with goals and values, the more content an individual tends to feel over time. There are many cognitive behavioral approaches to therapy, And two that have come up quite a bit in this lecture, as well as on this slide, are acceptance and commitment therapy, which is referred to as ACT, and cognitive behavioral therapy, which is referred to as CBT. The major difference in these approaches, which are both cognitive behavioral, is that acceptance and commitment therapy, as it sounds, focuses on acceptance and also on psychological flexibility. Acceptance and commitment therapy does not seek to change thoughts, but rather to make room for uncomfortable thoughts and feelings and to accept them while also choosing to focus on engagement in meaningful, goal and value-oriented behaviors. CBT is more interested in changing maladaptive thinking and unhealthy behaviors. It more directly identifies thoughts and labels them as maladaptive or adaptive, and then looks for strategies for the individual to replace those maladaptive thoughts with approaches to thinking that the CBT community would argue are more helpful for that individual. Since stress is a relatively universal experience, I want to take a few moments to teach you some relaxation, breathing, and mindfulness strategies that you can utilize in your personal lives as well as potentially in your professional lives as well. Let's start with the body scan. To engage in the body scan, the individual should either sit comfortably or lay down, whichever is preferred. You'll start at some point of your body. I recommend the top of your head. From there, you slowly kind of tap into what that part of your body feels like, and then intentionally relax it to the best of your abilities. So start with your scalp now. Maybe even close your eyes. See if you can get your scalp to fully relax, and then maybe move down your face. Release your forehead. Release your cheeks. Maybe move down to your neck. Release those muscles. We aren't supposed to be wearing our shoulders like earrings. For time purposes, I won't go through your entire body. But if you're interested in getting the full experience, I recommend pausing here so that you can fully go from the top of your head to the tip of both toes. Next, progressive muscle relaxation. There's a lot of overlap in the body scan and progressive muscle relaxation in the sense that they both seek to relax the body. The major difference is that with progressive muscle relaxation, rather than just scanning the body mentally and actively trying to relax, progressive muscle relaxation involves tightening the muscles and then relaxing them. I want you to try that even just in your hands right now. Tighten your hands as much as you can and then release them. You can feel that sense of relaxation. Progressive muscle relaxation is really effective for a lot of individuals, but caution is warned with people who have physical pain conditions or even an injury. You don't want to be tightening muscles that are already irritated or potentially injured. The body scan is always preferred for somebody where it is not safe for them to tighten their muscles. And just in case this wasn't clear, progressive muscle relaxation, similar to body scan, should be done throughout the entire body. Diaphragmatic breathing. This one is going to be a bit more challenging to describe using words, but essentially, the diaphragm is where we are supposed to be engaging when we are breathing. And instead, because we're so often stressed out, we tend to take very shallow breaths that stress our tiny neck muscles that were never meant to be our breathing muscles. If you have chronic neck pain and headaches, it may be that you're stress breathing. What we want to do when we diaphragmatically breathe is place one hand over the heart and another hand over the belly button. The goal is to only move the belly button hand when you're taking deep breaths. At first, this will feel hard for a lot of people who have never done it before, and you'll notice the tendency to breathe into your upper chest. I encourage you to practice this regularly to help train the body to take good quality breaths, rather than to engage in these very stressful, shallow breaths that not only do not give us the same sense of parasympathetic nervous system activity, which is helpful for our sense of relaxation, but also overuses those small neck muscles. To get the maximal benefits of these breathing exercises, it's important that you take deep, slow breaths in and out of the nose rather than the mouth. Next, box breathing. So box breathing and the activity after it, the ring exercise, both combine visualization with breathing. I really like both of these strategies, though I'm a particular fan of the ring exercise. Box breathing, just like it sounds, is syncing your breath with the visual of a box. I like to take a few breaths to see where I'm at that day, to determine where I feel comfortable in terms of the length of my breaths. So I might spend a minute breathing in and out and just counting my inhale and my exhale to see where I'm at for the day. I have a pretty long breath, so for me, usually about 7 to 9 seconds is ideal. But for others, it might be 3 or 4 seconds. It really doesn't matter, so do whatever feels safest and most comfortable for your body. Let's do 4 seconds, as that's generally suitable for many people. So for the box exercise, you'll start in the bottom left-hand corner of the box. Then you'll slowly inhale for 4 seconds as you move from the bottom left-hand corner to the top left-hand corner. Let's try it now. Inhale through your nose. 1, 2, 3, 4. Now hold your breath for 1, 2, 3, 4. Now from the top right, you'll exhale through your nose as you move down. 1, 2, 3, 4. And then hold again, moving to the left for 1, 2, 3, 4. Now we're back where we started, so we'll inhale for 4 as we move up. 1, 2, 3, 4. Hold for 4 as we move to the right. 1, 2, 3, 4. Exhale as we move down. 1, 2, 3, 4. And hold as we move left. 1, 2, 3, 4. You can continue with this exercise as long as you desire or need. You'll just continue inhaling as you move up, holding your breath as you move right, exhaling as you move down, and holding again as you move left. I do want to note that it is particularly important to focus on the exhale breath, as that is what stimulates the parasympathetic nervous system. Ring breathing is very similar, but instead of a box, there is a circle. I like this one as I find it a little bit more hypnotic and engaging, for me personally. So for this, I happen to picture kind of a gold Lord of the Rings kind of looking ring, but any circle would be fine. You start at the top of the circle, and you exhale from the 12 on the clock to the 6. So from the top of the circle to the bottom. You go exhale, and you see it light up as it moves along the exterior of the circle. Then, when you reach the bottom, you inhale, bringing it back up. You can continue doing that as many times as you need. I find this to be particularly effective when anxiety is interrupting my sleep. Next, leaves on a stream, which is an activity that is involved in act mindfulness. So this is an act strategy. Leaves on a stream, you're going to picture a stream with trees nearby. As a leaf falls from the tree into the stream, you print whatever you're thinking in that moment onto the leaf and watch it float away. And you continue doing that. New thought, onto a new leaf, float away. Continue on and on. 5 to 10 minutes is excellent, though that can be challenging for a lot of people. Leaves on a stream is really fantastic for a lot of reasons, one of which is that it's restorative and it involves kind of training your brain's ability to engage in mindfulness and meditation. The other really important aspect of this particular mindfulness exercise is that it really demonstrates the transient nature of thoughts and feelings. That is, when we don't fight with our thoughts and feelings, when we don't resist them and we don't try to avoid them, they go away on their own anyway. Eventually, totally new thoughts are printed onto the leaves. The last exercise that I'm going to teach in this lecture presentation is 5-4-3-2-1. This is oftentimes referred to as a grounding technique that de-escalates acute stress, and it's one that my clients really seem to find useful. For 5-4-3-2-1, we're going to use our senses. It can go in any order. So the order I'm giving happens to be my preference, but know that if you're under stress, the last thing you want to do is stress yourself out trying to think of the perfect way to do the exercise. As long as you are using your senses, it's likely to be effective. I like to start with 5 things I can see because that's the easiest. Next, I move on to 4 things I can hear, as that's generally the next easiest to accomplish. It might be the humming of the air conditioner or the garbage truck driving by. Next, 3 things that you can touch. And for this, you're not going to move to be able to touch something. You're going to tap in to the sensations of touch. So this might be how your feet feel against the floor, or how your back feels against your chair, or even how your hair feels against your neck or your shoulders. Next, 2 things that you can smell, and then lastly, 1 thing that you can taste. This is generally the hardest for people, so I always encourage them just to describe what their mouth tastes like in any terms. Again, it's not important that you do it right, per se. What's important is that you are engaging in a very present-focused experience. Our senses, by definition, are not yesterday or tomorrow. So by engaging in them, we are bringing ourselves to the present moment. While I'm not going to go through the right-hand list, I do want to make a couple of interesting comments. First, time with animals. So many of us are drawn to pets and animals, and the popularity of animal videos on social media platforms also speaks to how relaxing we find animals to be. The research supports the fact that time with animals, whether it's in person or even through visuals, can increase the activity of dopamine, oxytocin, and serotonin. Laughter, whether that is with people or even just watching a comedy skit or a funny movie, also aids relaxation, and it does so by reducing the secretion of epinephrine and cortisol, those 2 very important aspects of the stress response. The last thing we're going to talk about in this lecture presentation is resiliency and post-traumatic growth, starting here with some factors associated with successful aging. The research shows that individuals of medium to high socioeconomic status and who are in areas with low income inequality tend to fare best. Additionally, individuals who have relatively healthy lifestyles, such as not smoking, minimal alcohol use, consistent exercise, and a healthy body weight. Warm, stable marriages and overall adequate social support are also positively correlated with successful aging, as are mature and resilient personalities and approaches to coping. It tends to be that extroverted individuals, those who have meaningful social connections, and who score low on measures of neuroticism and depression, tend to fare best. These individuals are more likely to view bad situations as time-limited and isolated rather than generalized. They also oftentimes have an internal locus of control, which refers to an individual's belief that they have control over the outcome of the events in their lives, rather than external forces having greater influence. An internal locus of control facilitates resistance to learned helplessness, which again is associated with depression. I do want to note that an internal locus of control is helpful to a degree, but not in all cases. It's positive when the outcome is good, because we feel that we contributed to that positive outcome. But it can be very detrimental when the outcome is bad. It leads to thoughts like, if I had only done more, that sense of personal failure, which is clearly associated with not only more stress, but also a heightened likelihood towards depression as well. Another factor associated with successful aging is having effective outlets for frustration and engagement in valued activities. Also, people who are more present-focused, who don't get caught in the past, which is associated with depression, or wrapped up in the future and all of the unknowns and unpredictability that comes with that, which is associated with more anxiety. They also have a gratefulness orientation to life. They're more likely to recognize what is good about their lives, even when dealing with problematic aspects of their life as well. So what can we do to encourage well-being and resiliency throughout the lifespan? First, I want to mention that if you prefer to pause the recording to view videos, You might pause here to watch the video, 3 Secrets of Resilient People. So well-being is a cluster of individual factors, including psychological, physical, social, environmental, and economic. To truly be resilient, an individual needs to be able to adapt to stressors that come up in their lives. And this ability to adapt is affected by our own insight, our communication and problem-solving skills, and our emotional regulation. Resilience is associated with optimistic, approach-oriented coping behaviors and social support and a sense of purpose and meaning in one's life. Resilience is essentially the return to baseline following a stressor, or the capacity to withstand stress and trauma. I'll compare that to post-traumatic growth on the next slide. Most event-related changes in mood are short-lasting, days to weeks, and then the person returns to a previous level. But if events create permanent changes in circumstances, the individual needs to be able to adapt. And this ability to adapt is influenced by a lot of important factors, including genetics and temperament, the sense of social support, sense of meaning and purpose in life, belief in a religious system or spirituality, having high status or respect within a group, feeling like you fit into one's culture, resources to progress towards goals, being present-focused and having a sense of flow, and then again, grateful, not deficiency-oriented. It's about what we do have, not what we don't have. The Healthy Mind Platter, developed by David Rock and Daniel Siegel, is a helpful way of conceptualizing approaches we can take on a regular basis to help improve resiliency throughout the lifespan. Starting with sleep. As we've learned previously, sleep is essential for good functioning. Sleep gives the brain the time to rest and to consolidate learning and to recover from the day. Next, physical time. This involves moving, both aerobically and anaerobically. Focus time. This is time to be goal-oriented, taking on challenges, especially those that help make deep connections. Time in is time for quiet reflection, internal focus, focusing on sensations, images, feelings, and thoughts. Downtime is non-focused, without any specific goal, where the mind is allowed to wander and relax. This is also helpful for letting the brain recharge. Next, playtime. Time for spontaneity, creativity, playfully enjoying novel experiences, which facilitates new brain connections. And then time for connecting, ideally in person, though of course right now, in light of the pandemic, oftentimes virtually as well. It's important that we appreciate our connections not only to individuals, but to the natural world as well. This helps to activate the brain's relational circuitry and is correlated with well-being and resilience. Whereas resilience is rebounding back to baseline, post-traumatic growth refers to exceeding baseline. And like it sounds, it generally follows a significant trauma, but rather than the individual returning back to the baseline level they were at before the trauma, this individual experiences an excess in growth, such that they end up above where they were at when the trauma occurred. Post-traumatic growth is also referred to as thriving for this reason. There are many factors linked to post-traumatic growth, starting with self-enhancement. Self-enhancement is the tendency to recall positive over negative information. It's associated with high self-esteem, optimism, and perceived responsibility for positive outcomes. It likely minimizes the stress response, both in terms of lower baseline cortisol as well as lower blood pressure. Social integration refers to the number of social roles a person participates in. The value of social integration can be seen in workplaces that allow an individual to bring in various aspects of their lives. For example, having an area for play, or for bringing their dog to work or their child to work, and having team building activities. Relaxation we've already talked about, and it's so important in terms of activating the parasympathetic nervous system, especially in a society like ours where sympathetic nervous system activity tends to predominate. Relaxation strategies include things like meditation and mindfulness, listening to music, yoga, breathing exercises, time with people we value, reading, and even hypnosis. Spirituality, as mentioned earlier, can give an individual a sense of connection to something bigger than themselves, as well as enhance their sense of social connection. This can refer to organized religion, but it does not have to. Spirituality and religion promote problem-focused coping strategies, and, as stated earlier, reduce likelihood of engaging in unhealthy lifestyle behaviors. Again, it appears to help the person stay well, but does not necessarily increase survival chances after a diagnosis of any kind of illness. Curiosity refers to our attraction to novel stimuli. It enables us to meet our needs in new ways and to develop persistence. Seeking out opportunities for growth and stimulation is very important for overall contentment. It's associated with increased arborization, synaptogenesis, and neurogenesis. Perceived control and self-efficacy we've discussed previously. But again, we are more likely to take action and to avoid damaging behaviors when we believe we have control and when we believe in our own ability to cope and to take care of ourselves. Higher self-efficacy and higher control is linked to lower cortisol levels. And then lastly, the repertoire of coping resources in general. The more coping resources an individual has, and the healthier these resources are, the more likely they are to not only be resilient, but to potentially experience post-traumatic growth in response to a trauma in their lives. Again, I do want to note that it's the match with the situation and the environment. No trait or coping strategy is always good or always bad. This ends our lecture presentation for today. I do want to note that you have one other video to watch, which is What is Post-Traumatic Growth?